let me just first of all say this is Rob Collier from the Council of Michigan Foundations. Thank you all for joining us for this important webinar. And what we're going to be doing today is really addressing three very important subjects with the help of some very special friends and facilitators. The first is we're going to look at the state budget, the proposed budget that the governor introduced on February 10th, and what does that mean for the nonprofit sector. And we're delighted to have Rachel Richards and Pat Sorensen from the Michigan League for Public Policy to help us with that first installment. The second piece of this webinar is going to really focus on answering the question, what's the status of the legislation regarding the Detroit Public Schools and the Flint water crisis? And we've got Becky Beckler from Public Affairs Associates who will help us address that question. And then the third question is really the issue of how is philanthropy helping to respond to the Flint water crisis. And we're very fortunate to have Kathy Horton from the Community Foundation of Greater Flint lead us through that discussion. So on that note, I'm going to turn it over to our distinguished public policy fellow, Krista Gallick. Krista, why don't you give everyone kind of the logistics? And I believe we're taping the call, right, the webinar?
Yes, this call is recording, so everyone has been placed into listen-only mode. After each presentation, we will open the line for questions, or you may use the chat with presenter box that is right there to type in questions, and the co-presenters will take note of those throughout the presentation. And if you experience any technical difficulties during this call, you can contact ReadyTalk right here, this phone number on your screen. And I think that covers logistics. So joining Rob today is Rachel Richards and Pat Sorensen of the Michigan League for Public Policy, and Becky Beckler of Public Affairs Associates, and Kathy Horton of the Community Foundation of Greater Flint. So I think I am now ready to turn it over to our first presenter, which is Rachel Richards.
Okay, hi. I hope everyone here can hear me. My name is Rachel Richards, and I am a policy analyst for the Michigan League for Public Policy. As was noted earlier this month, the governor released his 17 budget. The grand total comes in at about $54.9 billion, which sounds like a lot. And in fact, there's probably many people who will say that this is, the largest budget in recent history. However, there's a number of factors that make it difficult for the state to fund all of its priorities, even considering a budget this large. And this first slide kind of shows that purchasing power has come way down. In nominal dollars, general fund, general purpose revenue is expected to grow 33% between 2010 and 2017. But when you adjust it for inflation, budget year 2017 GFGP revenue is 29% below 2000 levels. And then in nominal dollars, school aid fund revenue is expected to grow over 15% between 2010 and 2017. But when adjusted for inflation, budget year 2017 school aid fund revenue is 6% below 2000 levels. Another aspect that makes it difficult for the state to fund everything is that when you look at it, the largest unrestricted portion of our state budget actually comes in at less than 20% of what we use to fund it. So federal funds contribute over 40% of our state budget. State restricted funding, which includes funding for like school aid fund, and then much of our transportation funding is another nearly 40%. And then general fund, general purpose funds are less than 20%, so 18.6% of our state budget. Finally, when you look at general fund, general purpose funding by budget area, we're looking at just north of $10 billion for the governor's 2017 proposed budget. And when you look at this, it's important to note that funding that's been appropriated for health and human services, public safety, which includes MSP, Michigan State Police, and military and veterans affairs, which are included in others under this pie chart. And education make up nearly 85% of our budget. And education includes both traditional K-12 as well as community colleges and higher education. So when it comes down to it, you're trying to fund pretty much the rest of government on 15% of our state budget. And then some of the funds that have been appropriated for, say, health and human services is necessary in order to draw down federal dollars, and we really can't affect how much general fund and general purpose we put towards those priorities. So now I'll turn it over to Pat, who will get us started with all of the stuff that's going on within our budget.
Good morning, everyone. This is Pat Sorensen. I'm going to try to bring those billions and billions of dollars down into children and families for you, because that's really how it translates. This is a slide just showing in January of 2016 how many children in Michigan were receiving assistance through the Income Assistance Program, food assistance, through child care subsidies, and through Medicaid. So what you see is that disproportionately those who are dependent on public assistance and public services are children. About 70% roughly of those who receive FIP are children, and about 4 in 10 of the state's children are insured by Medicaid, just to give you some context for that. Next slide. Next, I want to talk a little bit. I love to start with the good news, and there is some good news in the governor's 2017 budget for human services, and we're splitting those up here, but as you know, the Department of Health and Human Services now includes both human services and health, but for purposes of understanding the impact, we're splitting them up a little bit. The governor did recommend an increase in the school clothing allowance. We currently provide about $140 per child in the fall to cover the cost of clothing for school. And this is important because the maximum grant for a family of 3 is only $492, so you can imagine that's not enough to budget for clothing. The governor recommends expanding that. It's provided now only to families that have what they call an ineligible grantee, which is really like a grandparent or a relative or someone who's taken the child in but isn't eligible or receiving assistance themselves. This would expand it to all children. So this is a real step forward in our minds. The other one we're calling out here is an increase in spending for family preservation programs of about $10 million. The state has made a number of fairly large investments in the child welfare system over the last 5 or 6 years, mostly in response to a lawsuit by Children's Rights. The problem was that lawsuit and the settlement agreement that came out of it did not address prevention in any way, and funding for prevention services has remained relatively flat after some cuts earlier in the decade, and so this is a major issue. So this is not permanent funding, but it is an attempt to try to beef up some of the money that we're spending on family preservation. We really think this is important to understand that every 100 kids in the state is currently in a family that's investigated for child maltreatment. So this is a huge issue for kids. Next, we're looking at some areas of disinvestment, and these are ongoing. This has been a decade or more in the making, which is that income assistance programs have been covering fewer low-income children because of state policies, and this is continued in the governor's budget with restrictions in public assistance. Our FIP caseload, which is our income assistance caseload, has fallen since 2011 from about 80,000 families to only 25,000 in the current year, and is continuing to fall. So we are concerned about that. The policies that we look at as an organization that have contributed to that are changes in lifetime limits for assistance that occurred in Michigan in around 2011. Also, we now sanction an entire family if one child is truant. That's also had an impact. And we continue to sanction people who cannot fully comply with work requirements, even though we know that low-income families face a lot of barriers. And I think of the families in Flint who have to comply with those work requirements, as well as try to get bottled water for their kids and try to get their kids to doctor's appointments. So it's really something we ought to be rethinking. Also, I should mention, in terms of the reduction in public assistance programs, is that we would expect, although we haven't been able to document, tick up in terms of the demand for local services that are funded through local charities and philanthropic organizations, churches, and the like. So that's something that we're hoping to be able to document. In the area of food assistance, we also had 16% of our kids are struggling for food, and one of the problems there has been the institution of a asset test. Michigan has put in an asset test for public assistance, which it doesn't need to do. 36 states don't have it, and this has further limited the access to food. This chart I won't spend much time on, but I think it's dramatic in terms of looking at it. These are children. The number of children in the orange bars are children that are receiving income assistance, and then the line is the percent of children who are in extreme poverty, which has stayed relatively high, even though since 2011 the number of children receiving assistance has dropped dramatically. And when we say extreme poverty, that's 50% of the poverty line, which is around $12,000 for a family of 4. So in the area of early learning, there were no major changes in the GSRP program other than some expansions in FLINT that you'll hear about. There was priority language instituted for homeless children, children in foster care, and those in special education, regardless of income. That follows some of the federal regulation changes. In the area of child care, again, most of the changes related to FLINT and are specific to FLINT. There were no provider increases, and we retain one of the lowest eligibility entry levels in the country. Finally, I just mentioned there's still no comprehensive 0 to 3 strategy in Michigan. There are some components of 0 to 3 that have been recognized to some extent. Last year we had a little bit of money put in the budget as part of the 3rd grade reading initiative for home visiting, and we have a federally funded early on program with no state funds at all other than in FLINT right now. So this is an important area for development. With respect to child care, funding for child care has again dropped precipitously. We were spending $460 million annually in 2006 on child care statewide, and it's down to $105 million in 2015. So it's a really rapid drop. And I offered here just some examples of the loss of funding into some of the larger counties in Michigan, all around 80%. And this is really important because it's important to children to be in high-quality child care if their parents have to work. It's important to parents so they can work. It's important to employers so that they can have a stable workforce. Again, here's just a quick chart to show you. There's one of the questions that we frequently get is, well, these are all federally funded programs, so there's no state flexibility to make changes in terms of eligibility. So, which just isn't true. You'll see on the top, the orange bars are the ones where the state does control eligibility levels, the Family Independence Program and the Child Care Subsidy, and they are, of course, the 2 lowest in terms of eligibility levels. So I think there is room for improvement, and there is state authority to do so. With respect to the K-12 budget, just very quickly through some of the issues in the governor's budget, just overall the school aid budget grew about 7% in the last decade, but the CPI grew about twice that rate. So while you do see a lot of debate about was there an increase in education or wasn't there an increase in education, it really depends on how you look at it. In total funding, yes, it went up, but in terms of keeping up with inflation, no. There were losses, and in some years there were actual cuts. So important to sort of understand that. The governor includes funding for an increase in the per pupil grant, which is about 60% or 65% of total school aid appropriations, and it's the bulk of the money that schools use for their operations. It's the primary source of operating funds for schools. So the increase will be between $60 and $120 using the 2X formula, and that's one that gives twice as much to districts that are at the lower end, and the point is to eliminate the gap, which Proposal A attempted to do. And in fact, the gap has been reduced to under $800 from $2,300 when Proposal A was passed. So that's been effective. The reading by third grade, there's a small reduction that reflects the elimination of two programs. One was a pilot and the other was a one-time funding. But it's largely continuation for the reading by third grade program. With respect to lowest achieving schools, the governor included $5 million for schools that are in the bottom 5%. Those funds, about $1 million is for CEOs in schools under the control of the State School Reform or Redesign Office, and about $4 million for supplemental payments. Lead testing in schools, the governor included, and this is separate from the FLINT funding, $9 million starting this year and then continued into next year for school districts to reimburse them for doing lead testing within their district, which we think is a positive to pull that statewide, what has been exclusively focused on FLINT, and then $10 million for educator evaluation training. This chart is just to show you the at-risk program. For those of you who aren't familiar with it, is funds allocated based on income of children, so it's a really good mechanism for helping districts with high proportions of low-income kids. There is a formula that is in statute that has not really been followed for many, many years. As a result, since 1995, there's about a $2 billion shortfall in the funds that have gone to schools. Last year, legislature did increase it by $70 million, but we're still $134 million behind what we should have been had we followed the statutory formula. In physical and behavioral health, again, some good news. We finally have taken the Healthy Kids Dental program statewide. So this budget expands it to all Medicaid-eligible children in Kent, Oakland, and Wayne, which were the last to be covered. So we now have a total of over 825,000 children covered in all counties at a cost of over $220 million. For the Healthy Michigan Plan, as you will recall, beginning in 2004, Michigan expanded Medicaid through the Healthy Michigan Plan to include non-disabled childless adults up to 133% of poverty, and that was originally covered completely with federal dollars. So next year, in fiscal year 2017, is the first time the state has to pony up 5%, which comes to about $109 million, and the governor included that in his budget, and I'm sure it'll be debated. Then there are more than 600,000 people too, I should mention, that are being covered by that program. It's been a resounding success. So also a small increase in local public health. One thing I didn't mention, and we can talk about that later with respect to health, there was a lot of money put in the budget for specialty pharmacy for hepatitis C and cystic fibrosis drugs. very high cost per patient, and it's one of those problems that's looming on the horizon for the state if we begin to cover those more broadly. So, in terms of the controversy, and I won't spend a lot of time on this, but mental health and substance abuse, as part of the Medicaid expansion, we cut back funding for non-Medicaid, for mental health services for persons who are not eligible for Medicaid last year by $168 million, and there was a lot of concern in local community health services agencies about not having sufficient funds to cover the need as a result, that it was done too quickly and that too much was taken. That level is continued in this budget, and it's relevant to know that in the last 15 years, Medicaid mental health spending has increased by over 133%, but non-Medicaid spending has fallen by about 75%, so this is a major issue. And then sort of the sleeper issue, which has become a very controversial issue, was that there was boilerplate in the governor's budget that shifts funding for behavioral health services. It's about $2.4 billion total from to the Medicaid health plans effective the end of September of 2017, so the end of the upcoming fiscal year. And that's drawing a lot of controversy. The goal of the department and the governor is to integrate mental health and physical health, but opponents are pointing out the cost of overhead of public versus private plans. So it'll be very much in the media. I'm going to switch back to Rachel for the last one, and then we'll open to questions.
So a lot of the workforce development programs that are run through the state are actually funded predominantly in part by federal funds, and so there hasn't been much additional support given to those programs via like state general fund general purpose. So the funds that are essentially passed down to like the Michigan Works programs, a lot of those are federal funds that are essentially passed down through the state. Some of the areas I will talk about, there is some additional money that's been provided for the Community Ventures program within the Department of Talent and Economic Development. This is a program that is attempting to help address some of the structural unemployment in some of those low-income cities, such as Flint and I believe Pontiac, Saginaw, and Detroit are the other three. So what they're doing is they're doing essentially up to $2 million in general fund that would provide a one-to-one match to encourage some private contributions to this program. The Skilled Trades Training Program, which essentially helps address talent mismatches by giving grants to employers to help either retool their employees or get some specific skill training to employees or potential employees, is proposed to be a $10 million increase to total $35.6 million. This is a combination of general fund and other restricted funds. The governor's budget also includes a pot of one-time federal funds for grants to fund financial literacy pilots for cash assistance recipients. And finally, they're going to do some one-time funds to replace and integrate the data system in order to kind of align some of the reporting requirements. On that note, there are a number of things to watch as the budget moves through the process. Obviously, the House and Senate are currently working on an overview of the governor's budget, and will then start releasing their budgets, generally probably by the end of March, beginning of April. One of the things to watch is currently the Michigan Earned Income Tax Credit, which is at 6% of the federal credit, was at one point part of the road funding proposal, and it passed out of the House, and it passed out of a Senate committee and is sitting on the Senate floor. Right now, we don't believe it's an issue, and we haven't heard whether, we haven't heard that it's going to become an issue, but it's one of the things that as the budget puts, or as funding limitations put pressure on our budget, it's one of those very easy credits for the current legislature and administration to propose to either cut or eliminate completely. On top of that, we have road funding. As part of the road funding proposal, between $90 and $100 million per year was put into what's called the Road Innovation Fund, which the funding can't be released until the legislature says so. And they're expecting a report to be released, I believe, by end of March. And so the governor's budget does anticipate the release of these funds in his budget, but that has yet to be seen. Additionally, there's a very small amount of general fund that's put into the Department of Transportation. In recent years, however, we've put in up to about $400 million in order to meet federal match requirements and whatnot. So we'll see if the legislature decides to put a little bit more pressure on our budget overall by putting more general fund into roads, so that we can kind of jumpstart some of those road projects that are still lingering. As Pat said, there's an issue of Medicaid and Healthy Michigan plan financing. The state now has to start chipping in and providing a match for the Healthy Michigan plan. It's 5% for fiscal year 17, and it grows to 10% over the next several years. On top of it, there are a number of changes that have been made. Pat had mentioned the specialty drugs, as to whether we're going to provide them via the formulary statewide through to all Medicaid patients. or, and the fact that, depending on caseloads, the state will have to start contributing either more or less and putting in more or less state dollars depending on that. Finally, we're going to start seeing some increased stress on the general fund as the personal property tax repeal provisions phase in. More general fund gets siphoned away in order to pay local units of government and schools for the losses associated with it. We also have the road funding plan, which starting in budget year 19 will start eating away a little bit more at the general fund, as well as the $600 million earmark gets phased in. And finally, we still have these legacy MBT credits that are kind of hanging over us, and when they come in and to what extent is still unknown. So that will have an impact on how much money we have to play with as well. And so we are available for questions if anybody has any.
Thank you. This is Rob Collier. Thank you very much, Rachel and Pat, for that update on the governor's proposed budget. And Krista, we're going to make sure everyone gets a copy of these slides, right?
Yes.
Great. So you'll all have that, and people will be able to listen to this. We're a little bit behind schedule, but maybe we could just see if anyone has any burning questions, and we'll make sure everyone has Rachel and Pat's
The conference is no longer in listen-only mode.
Sorry about that, Rob. I just unmuted the lines. So if anybody has a question, they can ask our presenters.
Well, hearing no burning questions, we'll make sure everyone has Rachel and Pat's email addresses as well as the content today. And obviously the budget is always a work in progress, but we wanted to make sure everyone knew what it meant, particularly given the foundation community's interest in these three broad areas. So at this time, Krista, let's turn to the next phase of our webinar, which we're joined by Becky Beckler from Public Affairs Associates, a longtime colleague and advocate for the nonprofit sector and philanthropy. And Becky, the foundation community has asked for an update on what's happening on the Detroit Public Schools, and then also if you can give us an update before we get into Kathy Horton's presentation on what's happening with the FLINT supplemental. So we'll turn it over to you, okay?
Yes, thank you. Can everyone hear me okay?
Yeah. Do you know if there's a time period? Have you done these before where there's a time period that you have to...
Can everybody hear me?
Yes.
Okay.
Yes.
Well, thank you. Well, as you know, there are two burning issues in this budget. The first one is something that the governor has been talking about for months, and that is Detroit Public Schools, and as they approach what could be a bankruptcy, how the legislature will address that to keep them from going into bankruptcy. In response to that, the Senate introduced two bills about a month ago by Senator Jeff Hansen, who also chairs the state school aid budget for the Senate. In conjunction with the Senate Majority Leader, they have had several hearings. It is our understanding that the Senate Majority Leader, who chairs the committee, it's been sent to Government Operations Committee. He does plan to move something this week. And let me just give you a little behind the scenes what's happening, is that the Senate Majority Leader has been trying to negotiate with the mayor of Detroit. The key provision that has been a sticking point was the creation or possible creation of a Detroit Education Commission. And how much authority would the mayor have over this Detroit Education Commission? He, of course, would like extensive authority over that and would like control over not only the school system, Detroit Public Schools, but also the charter school and the alternative education community. And there you have the sticking point in the Senate, and the Senate is not willing to give total control of the charter school movement over to the mayor. They were willing to give him control over new charters, but not existing charters, as long as those existing charters were successful schools. If they're failing schools, it doesn't matter who's in charge, they should be eliminated. But that has been the conversation. It's our understanding that over the weekend those conversations broke down, so that the Senate Majority Leader is contemplating a couple options, either modifying his version, the Senate version, to not include a Detroit Education Commission, or stay with his provision of having one, but limited control. It still has what the governor wanted as far as the new co and the old co. The old co keeps the debt. The new co gets the $200 million to move forward, as well as the foundation allowance to pay off the debt. It would go with an elected school board, which is something that's very important to the education community, and maintain current union contracts. Now, adding into the mix of that is last week the House introduced their own version of Detroit Public Schools remedy. Rather than using the tobacco settlement money, which the governor has proposed, and the legislature appeared to be wrapping their arms around, they're going to use it out of the general fund, the $72 million a year. What they plan to do is repeal a insurance tax credit that insurance companies received starting last year, which is about an $80 million tax credit to insurance. They're going to repeal that. The six-bill package is pretty aggressive on reforms, where the Senate did not go there yet. They put limits on collective bargaining, on work schedules, school calendars, limits on how they can contract with third-party vendors. All new district employees would have to go into a part of a 401k rather than the current hybrid plan. There also, some of the education initiatives would be A through F letter grading for schools and third grade reading requirements. I will say that last week I don't think anybody was taking it too seriously. They kind of saw that more as a threat. But because the conversations broke down and the disappointment that the Senate Majority Leader, he's actually taken a new look at the House version and whether they want to include some of those provisions in his version. But I think you will start to see some activity as soon as this week on Detroit Public Schools, getting that moving forward to keep those conversations alive. But that is what has happened over the weekend and starting with today. Of course, that, as you know, in the legislature, that could all change. But as we were given information this morning, that's the situation with Detroit Public Schools. Does anyone have any questions? Okay, moving on then. The second piece that is also a very expensive endeavor, but something that is very important, is dealing with the Flint water crisis. The governor in his budget had a rather aggressive plan of $232 million when everything is passed. His idea was, and some has already started to move forward, is the monies for Flint would come through supplementals. And the reason for that is if he didn't do it through supplemental, then none of this money could get to the Flint residents and some of the education pieces until the budget is adopted and effective October 1. So that's why you're seeing the supplemental movement as opposed to moving it through the traditional budget venues. He has proposed $37 million towards safe drinking water, $15 million towards food and nutrition, $63 million under the category of physical, social, and educational well-being, $30 million a water relief fund which the legislature has already sent to him, and then there's a $50 million in reserve for future needs of Flint. The idea of the governor is he believes that there will be additional costs incurred. We aren't certain as to where those additional costs may be, so he wanted to ask for that reserve fund to be used within the next year. And it didn't necessarily, his qualification was he didn't necessarily want it to be just October 1, but the legislature is still contemplating that. The governor's budget includes a few reserve funds that is causing the legislature to pause because there's just so many pockets of unidentified funds for the governor's discretion. And the legislature, as you all know, is very leery of just leaving the administration to dedicate those resources. So that's the detail on the Flint. It's still moving through. We have not seen any pushback from legislators on the governor's initiative other than perhaps, and I say perhaps because I'm not certain, whether they'll push back on that $50 million reserve or allow that to maintain itself. Anybody have any questions?
Becky, this is Rob Collier. Can you just comment, so the $30 million for the water credits has already been through the legislature and has gone to the governor for him to sign, right?
Yes, that's correct. I believe he signed it.
And so is the intent on these supplementals to get them all done, by June? Or because I'm assuming the legislature wants to get done with this so they can all go out and campaign, right?
Oh, absolutely. Matter of fact, the goal of the legislature is to have the entire budget done by the end of May. They were pretty close, if not hit that target last year. It's something that this legislature takes very seriously. I think for the Flint supplementals, they would like to get as many done by the end of March as possible. There's a 2-week spring break the last week of March and the first week of April. They would like to move those supplementals so that those aren't sitting there for 2 weeks and not being able to help the residents. So I think you're going to see those move in March as much as possible.
So, Carissa, could you just go back to the first slide just for a second, or whoever's controlling the slides, I think you are, just so that we can explain to folks. Oops, no, the first one on Flint, sorry. The first one on the water crisis. So, yeah, there we are. So Becky, just if you can just quickly make sure we all understand. So the first two supplementals would be Public Act 143 and Public Act 3. So those have already gone through, and we're now working on the $30 million that's in the one that just went through is part of the $147 million in that proposed budget, as I understand it, right?
Correct.
So, and the reason why we have gross funding versus general fund, general purpose is because in the $232 million, I'm assuming there's some federal dollars being allocated?
Yes. Yeah, there are federal dollars that are being allocated, as well as the governor has asked to do Medicaid expansion in Genesee County, and they believe that the federal government will approve that at some level. But that's not included in this.
Okay, thank you. So does anyone have any questions? These two charts are very helpful to give you a good picture of, in responding to the question of what is the state doing. Here it is, and I can just share with you that there's a lot of detail behind every one of these numbers. And for example, $6 million of the 9.3 in that first supplemental last fall was to pay part of the cost, and the C.S. Mott Foundation put $4 million into it as well to help Flint reconnect to the Detroit water system. But if anyone wants to see, there's a lot of detail behind each of these numbers, and go to the next chart if you would, Carissa. And these next buckets show, how a lot of it is going with additional nurses under education and school aid, to food bank resources, home visits, et cetera, under health and human services, et cetera. So if anyone has any questions about what the state is doing to respond to Flint, these are two good summary charts. Becky, anything else in terms of issues related to state government around Flint and this package of supplementals?
No, that's the financial end of it. I think you'll see, as you all have probably read over the weekend, the governor has also released additional emails regarding the Flint water crisis, which has stirred up all more conversation. And then late last week, the legislature has created a joint committee on the Flint water crisis. So I think this issue is going to continue to be on the front burner, both in the legislature as well as the administration. And then, of course, you're going to see it in the print media as well, because this issue is going to continue on, I think, for quite a long time.
Well, Becky, thank you so much for joining us. And once again, if anyone has any questions of Becky, we'll make sure you have her email address as well when we post this slide deck for everyone to have. Carissa, should we move on and let's hear from Kathy Horton and what's happening in Flint?
Yes, really quick.
Kathy,
Sorry, Rob. I'm going to place the conference in listen-only mode. I did have the lines open for questions.
Right.
But I'm going because it announces when the lines when it's in listen-only mode. So I'm doing that.
The conference is now in listen-only mode.
And I can open up lines again for questions for Kathy when after her presentation. So, Kathy, you're up next.
Uh-oh. Good afternoon.
Yep, you're on, Kathy.
Okay, all right. Thank you for this opportunity to talk a bit about what philanthropy has done in terms of responding to the Flint water crisis. I want to say that this is just one sliver of what has been an amazing response by the philanthropic community, and so there's a great deal beyond what I'm going to share with you right now. Our greatest effort at the Community Foundation has been related to the Flint Child Health and Development Fund, which has gotten branded as the Flint Kids Fund. This was a fund that was established by Dr. Mona Hanna-Attisha, who is the pediatrician who first discovered and rang the alarm bell about the elevated blood lead levels of children in Flint. Before going into this fund, I want to just make a few remarks about some of the grant making that we have been able to do in response to the crisis. Thanks to our Michigan Health Endowment Fund grant, which was about $500,000, and some additional resources that the C.S. Mott Foundation has given to the Community Foundation, we have deployed $250,000 toward the water crisis, and we'll be deploying another $300,000 within the next couple of weeks. This is related largely to nutrition intervention, which is one of the most important things to mitigate the effects of lead exposure. But the Flint Kids Fund is the fund that Dr. Mona has really pushed forward. This fund was established to be the long-term fund available to respond to the families in Flint, the children who've been exposed to lead. It is meant to be a supplemental resource to the kind of funding that will be coming in from the federal and state government. And so it really is not meant to do it all, but to supplement. It's essentially here to support the health, nutritional, educational, and social behavior interventions that mitigate lead exposure and ensure a more likely outcome related to health and development of these children. In Flint, there are roughly 10,000 children in the most vulnerable age bracket, which would have been infants or babies in utero through the age of 6. This is the age when the neurotoxin that is lead has the most long-reaching effects on the health and development of children. And this will be a high priority of the fund. Dr. Hanna-Attisha was the founding donor, but the fund was really kind of the brainchild of the local agencies that were on the front line of the response. And so this is a field of interest fund held by the Community Foundation, but it will be advised by a community advisory committee. Sitting on that fund will be community residents from Flint, and then the partner organizations that really conceived the idea of the fund. So United Way of Genesee County, our Greater Flint Health Coalition, Mott Children's Health Center, Hurley Children's Hospital, and of course the Community Foundation. We have experienced an enormous outpouring of generosity. A little over $2 million has been contributed to date. There's another $1 million that have come in as written promises, primarily from corporate foundations. We've had nearly 8,000 donors who have made gifts. These gifts have come from every single state in our union, and you may be surprised to hear, but it's been a global response from countries such as Afghanistan, Australia, Belgium, France, New Zealand, United Kingdom, Singapore, just a tremendous response from really around the world. There are literally dozens of fundraisers that are in process right now. These have all been initiated by us. To be honest, we have yet to make a single ask. It's just people are so aware of how horrible this has to be for our community, for the children, for the families, and they are coming up with all sorts of creative ways to contribute to the fund. We are just in the process right now of pivoting to what will be a more proactive approach. While we are thrilled to say we've got close to $3 million for this fund is meant to last for 20 years for the trajectory of these kids' lifetime until they get into adulthood. And our founding donor, Dr. Mona, has a vision of $100 million for this fund. So you can see we have a long way to go to get those kind of resources. We know that when funding comes in from the government, it typically has restrictions, and this fund is meant to be the flexible place where we can make sure families can fully access what may be made available through government services and kind of fill in any gaps. In addition to the Community Foundation Flint Kids Fund, United Way has played a really important role in the immediate response with the water crisis. They were kind of first on the scene to open up a Flint water fund. Initially, this was used by water filters and bottled water, but then the government came in a significant way, the state did, and you cannot believe the number of cases of bottled water that have been contributed to the Flint community. So many that most of the warehousing has been taken up, and they are now storing them at Selfridge Air Force Base. United Way is also trying, as it has raised funds, to get money to kind of the frontline service providers like Red Cross, like the food bank, to ensure that they have the capacity it takes during this initial immediate response. And they've also been very transparent with their donors to say that any funds that they raise during the water crisis that are not needed for the immediate response will be transferred into the Flint Kids Fund. I wanted to say one other word about our Community Foundation response. So our pipes are in horrible shape, and probably the greatest tragedy of this, in addition to the lead exposure of very young children, is the decimation of community trust. It is very hard to believe anything that comes from an official resource. So our Community Foundation has 20 years of operating a neighborhood small grants program, thanks to the C.S. Mott Foundation, which started that fund for us. And we are presently looking for ways to use the 20 years of relationship building with block clubs and neighborhood associations to address the Flint water crisis. Of greatest need is to ensure that better communication around key health aspects get to residents. We have learned that they don't necessarily use what would be considered traditional media, and we're looking for ways to employ citizen ambassadors in terms of getting out the best and most reliable information, and then to begin to engage residents in solutions with the idea that what we really need to do is rebuild the trust that has been completely decimated through this crisis. Lastly, I will say, as terrible as this crisis is and has been, there is emerging a mindset of opportunity which is a hope that the response will be so significant to bring resources in for these families, many of whom live in poverty, to be able to do the kind of interventions that are critical around early childhood, comprehensive health, the whole issue of nutrition, and quality schools. And we are hoping at the end of the day that this will become a great story, and a story that will be taken statewide and back to our legislature for the kind of interventions that every community, especially those with significant numbers of families living in poverty, need. And so while things are still chaotic and confusing and we don't feel like we have any answers yet, there is emerging a really strong belief that we can marshal resources and really change the outcomes of these kids for the better. And now I would be pleased to take any questions, or if you really want to understand anything better, we do have our Director of Communications contact information up there if anyone wants to contact Mary Jo Herbig after the conference. So
thank you very much,
okay.
Kathy. Thank you. This is Rob. Thank you so much for giving us this update. And let's see if anyone has any questions about all of the different ramifications you've covered.
The conference is no longer in listen-only mode.
Anyone have any questions for Kathy on her update on Flint?
I've opened the line so people can ask questions, and you can also type them in the box on the left-hand side of your screen.
Kathy, this is Rob. Just while folks hopefully are formulating questions to ask you, I would just say, you know, in terms of next steps, you indicated you're about to pivot to a proactive mode because the goal is to obviously grow this fund. And I'm assuming then, you know, we can obviously expect you'll keep us posted on new developments that we need to share with all the members of the Council of Michigan Foundations and the philanthropic community.
Yes, I can do that. And I should also mention that this fund is just one of several that have been opened by donors. So we have another donor who opened up what's called Safe Water, Safe Homes. The purpose of that fund is really to provide emergency relief for homes that have damaged lead plumbing as a result of the water crisis. So that's another fund, and we also have a fund that has recently been opened for economic development programs called Moving Flint Forward. So we expect as the community begins to do kind of the comprehensive response that we could have a constellation of funds, each with a specific purpose. The Flint Kids Fund is the greatest concern that people have right now because of the devastating impact to kids' development and health related to the lead exposure.
Thank you, Kathy. Any comments, questions for Kathy Horton? Well, as our hour brings to a close, if anyone has any additional follow-up, you've got Mary Jo's contact information on the screen right now, and CMF will work closely with Kathy and her colleague foundations in Flint to make sure everyone knows what's happening. Clearly, as we heard from this webinar, the governor and the state and the budget process with these supplementals will be providing some much-needed assistance. But what we've also learned is that gaps do occur because of the way laws and regulations work. So we'll keep people apprised of opportunities for the philanthropic community to support Kathy's fund. And Kathy, thanks for mentioning the other two funds, the Economic Development Fund, because I know that has been a question a number of folks have had. So it's good to know that you've created that one as well as the Safe Water, Safe Homes Fund. So thanks for sharing those two as well. Carissa, any other additional details that we need to cover for folks as we close up our webinar today? I just wanted to mention that we will also be letting, if anyone wants to know about the federal budget and its implications, there is a webinar, a live presentation going on today, which we're taping, and we'll be making sure that that's available through the Grant Makers for Income Security Task Force, which several of our Michigan foundations support. So we'll have that available as an additional resource too. But anything else you'd like to cover?
Once again, I would also like to thank everyone for joining us today and extend our thanks to you, Rob, and also Rachel, Pat, Becky, and Kathy. And later today, participants will be emailed a survey link from CMS for an evaluation of today's program. Please take a few minutes to complete the evaluation, as your feedback is very important. And please disregard the ReadyTalk default evaluation that will populate when you complete this webinar. And that's all I have. Did you have anything else, Rob?
No, I think we can officially adjourn, and thank you all very much for joining us. And once again, happy Leap Year Day.